As the economy struggles due to the COVID crisis, 50-plus voters are rightly worried about jobs and retirement security. Is there any light at the end of this tunnel? Let's find out. Leading this next conversation is my awesome colleague, Julia Manchester, political reporter at The Hill. Julia, it's all yours.
Thanks, Steve. Dr. Monique Morrissey is an economist at the Economic Policy Institute, where her research focuses on Social Security, pensions, and older voters. And Dr. William Spriggs is a professor of economics at Howard University here in Washington. In addition, he serves as a chief economist to the AFl-CIO, a federation of 56 national and international labor unions that represent 12.5 million working men and women. Welcome to both of you, Dr. Morrissey and Dr. Spriggs. Dr. Morrissey, I want to start with you. You know, I'm a journalist and I often see headlines and reading the papers and such about the uncertainty of Social Security and how long Social Security could be with us and could be with a number of Americans. You know, I just want to ask, what should people be thinking about being prepared for in the event that Social Security is no longer financed here?
Well, I'm not as worried as some people are. I just cannot imagine that Congress would let funding lapse for Social Security. You know, I mean, I understand people want to be concerned about it, but it's never happened. I don't think it will happen again, this time. And but I think a bigger issue is Social Security enough? And I think a lot of people are talking about needing to expand Social Security. Meanwhile, we have the president who has recently cut payroll taxes or deferred them and talking about undermining funding for Social Security, which I think is a much bigger short-term concern.
Right. And Dr. Spriggs, I want to go to you on this issue. You know, frontline workers, you see them quite a bit in the news right now. They are very much on the front line of this pandemic. But I just wanted to get your take on where regulatory protections for frontline workers, particularly older frontline workers and others at heightened risk for contracting coronavirus, you know, and other contagious diseases. Where could those practices be strengthened and updated?
When we had the H1N1 flu back in 2009, OSHA, which is the Occupational Safety and Health Administration within the Department of Labor, almost immediately issued emergency guidelines because it's an airborne disease and there are special precautions that have to be taken for protecting workers in those conditions. This time, OSHA refused to issue emergency rules, and the AFl-CIO, in fact, had to sue them. Unfortunately, we didn't win. But
you need to leave right now.
But
right now.
We do have some solace in that in Virginia and in Michigan, those states have issued guidelines, and the state of Oregon is in the process of issuing them. But this is the real breakdown in the United States, because within the United States, we have suffered so many spread of the virus from people at work. And this isn't happening in the rest of the world. The rest of the world is operated with guidelines. They sat down with their workers. They bargained about these things well in advance. And the concern for older workers has been this exposure that wasn't necessary. And for workers in senior facilities, this is the most noted case. The studies that have been done recently have shown that those nursing homes that were union had far fewer outbreaks and they were less severe, and the workers were also safer. So there are ways to solve this. It can happen if workers have a voice, but this is a very dangerous situation that we don't have the leadership from the top on this issue.
Right. And on that note, with other countries doing a much better job of this and handling this, how does the U.S. kind of get on their level of regulatory practices? And like you said, Dr. Spriggs, meeting with these workers and having communication with them. You know, is it possible for the United States to, you know, catch up with a lot of these countries in terms of how government is relating to these frontline workers?
Oh, absolutely, because it's fairly straightforward. In those cases where we have had unions so far during the downturn, the loss of jobs have not been as severe, but we know that we still have to address workers who aren't organized and who need safety protections. So we could have OSHA step in. we could have more OSHA inspectors, and we could have more inspections taking place to help give legitimacy to the voice of workers being raised. We've had thousands, literally thousands of safety complaints filed and not have OSHA respond. And the 2 times that OSHA has responded, this has been very minimal penalties, not enough to send a clear message either about the standards that need to be met or with reference to, getting other employers to understand that OSHA takes this serious.
Right, right. And Dr. Morrissey, retirement is a huge issue for people right now. Obviously, money is very tight for thousands of Americans across the country and American families. How do people ensure that they're going to continue saving for a future or have their retirement plan with money being so tight and with there being an economic downturn?
Well, I think that for workers who are unemployed, I mean, they have worse problems to think about. For everybody else, as much as possible, they should continue to contribute to their 401k. But I think it's really important to keep in mind that the vast majority of workers, when they retire, are going to rely primarily on Social Security. We just recently got the results of a survey from 2019 that shows that the typical household, the entire household, husband, wife, everybody, has about $144,000 in retirement savings, if they have retirement savings at all. So about half of households have nothing at all, and half of the remainder have less than $144,000. And these are households approaching retirement. So this is not just any age household. This is 55 to 64 when they're at a peak. And that's about enough for a monthly annuity of about $500, $600. It's less than what you're going to get from Social Security, and those are the people who are lucky enough to have something. So 3/4 of households either have nothing or have less than $144,000, and this is the households that are approaching retirement. So, I mean, the bad news is, a lot of households are in this situation. The good news is, if you're out there and you're listening to this and you thought you were alone, you're not. You're typical. I mean, very, very few people have a meaningful amount. Maybe only the top 20% of households have a meaningful amount saved in retirement accounts, which isn't to say to not keep saving, but we should all be more worried and more concerned about jobs, Social Security benefits than the stock market.
Absolutely. And, during this summit, this virtual summit we've been talking a lot about the 50 plus female demographic. And Dr. Morrissey, I want to put this one to you. Where does this demographic look for advice on add-on plans or savings to supplement their existing retirement plans right now?
I think that women tend to be more social. They have a reputation for being more conservative in their investments. One thing that's important to remember is women they need to save more because they tend to live longer. And they tend to have less money put aside, but this is not for lack of participation. We have closed the participation gap between men and women. Women intend to and do try to save as much. But they are also more likely to be in low-income, low-wage jobs where the employer is not offering an employer plan, they're more likely to have other obligations. Again, just day-to-day needs. So I think that women are doing a lot better than they used to be. They're closing the gap, but unfortunately, they also need to save more, and they are not saving enough, as are most people not saving enough. And the same goes also for single men too. So there is also a problem with people living alone as opposed to couples. Couples tend to be a little bit better off on average. But that's also because married couples tend to be, in general, in a higher income bracket on average. So it's kind of hard to disentangle the two effects. But we are very much worried about women not saving enough. They live longer, and they, the whole system needs to be fixed to make it easier for people to save. Nobody should have to be their own investment advisor or rely on random advice from people or friends. I highly encourage people, if you're going to hire an investment advisor, to make sure it's a fee-based advisor and not somebody who is going to be making money off of you're making lots of trades or whatever, who is going to be giving you disinterested advice, and to research that. So I think that's a really important issue. And it's actually something that we've been concerned about because under the Trump administration, they rolled back some requirements that the Obama administration put in to protect retirement savers by requiring people who were passing themselves off as financial advisors provide disinterested advice, like advice that's not subject to conflicts of interest because of how they're going to get paid, and that was basically scrapped. So we're sort of in a more dangerous place than we used to be, but everybody should be careful. And if you listen to a financial advisor, you should definitely listen to one who you've paid to give you unconflicted advice. Thank you.
Absolutely. And Dr. Spriggs, I want to turn the conversation towards disadvantaged workers and how these workers can be helped. I wanted to ask you, how can policymakers in particular easily address power imbalances between employers, workers, and target policies towards disadvantaged workers, including unemployed older workers in the pandemic?
Well, unemployed older workers are facing a huge problem because the system for unemployment insurance has been totally overwhelmed. And this has put a huge strain on the system. Initially, we had workers who were thinking they were going to be temporarily unemployed. We're now seeing a huge shift to workers reporting that they will be permanently unemployed. And as this goes on, we're seeing the length of time that people are unemployed going up. So we're seeing a transition slowly of permanent unemployment and long-term unemployment going up in the same way we saw at the beginning of the Great Recession. And this is a huge problem for older workers. They are nearing retirement age. They're nearing the point where continued engagement with the labor market is a challenge. And last time, this resulted in a large number of workers, instead of staying connected, applying for disability insurance. So this is the crises that we're facing at the moment. In terms of their safety and getting voice, we really need to have OSHA step up so that the workers who are on the job feel that they're going to be protected when they raise complaints. And this just takes physical presence on the part of OSHA at many of the hotspots, at nursing care facilities, at meat packing facilities, at transit facilities. These are hotspots we have seen develop. And when workers see OSHA inspectors, they know that there's going to be some safety for them, even if they are not organized. So these are some of the things we need to be cautious of right now. The $600 that has been withdrawn from the unemployment insurance is really a catastrophe. It will invite more people to file for disability instead of remaining unemployed. And that's one of the things we were able to stave off at the early part of the summer when the $600 had been added to the unemployment benefit. We really need that to be back and for people to be able to build up their liquidity, because as Monique was mentioning, there's this big problem in building up savings. And so many people do wait, unfortunately, until later in life to pump up their savings. So they're missing this opportunity.
Right. Well, Dr. Morrissey and Dr. Spriggs, I'm going to have to leave it there, but this is a conversation we really should continue to be having throughout this pandemic and really as we continue to talk about the issue of retirement savings and Social Security. So thank you so much for joining me. I'm going to toss it back to Steve now.